These privacy policies are required to be there by law. People are putting resources into developing them. They're putting effort into developing them. Since it has to be done, we think that it should be done in such a way that people, consumers, can read them, will want to read them, and will have the opportunity to understand the privacy practices of that organization. So we've come up with 4 different ways that you can express a privacy policy. And what we've done is compared how people feel about these different expressions and how well they comprehend these different expressions. And to do this, we used a survey approach, and we based it on some of our earlier work, our privacy requirements taxonomy, which was started several years ago. And what we did was we analyzed over 100 privacy policies online, and after analyzing in great detail all of these policies, we categorized all of the information in the policies. And when we were done, we found out that every piece of information in the policies fell into one of these categories. And then these categories, we were able to break these up into either protection goals or vulnerabilities. So when you look at a privacy policy, there's usually a group of statements that talk about how the company protects your information, and then there's usually a group of statements that talks about how the company might do something that could potentially cause the consumer to be vulnerable to something bad happening to their information. So with our particular experiment, we had 3 primary goals. We wanted to gauge the user's perception to the 4 different alternatives. We also wanted to measure the comprehension, and then we wanted to compare to see if there was a match between what people felt comfortable with and what they understood the best. So our experimental design used 4 different treatments, which we refer to as variants. And the first variant was just the original natural language policy that is commonly used today. So if you choose any given website, Amazon's website, eBay's website, any website, more than likely it's going to have just a plain natural language privacy policy. So that's what we started with. And to compare to that, what we did is we took that same policy and turned it into a list of privacy goals and vulnerabilities based on our taxonomy that we created. The third variant was a categorical representation that was based on that same privacy taxonomy. And then the fourth variant was a combination of the original commonly used natural language policy with the goals and the vulnerabilities highlighted. So I have examples to show you of each of those. The first variant, here's an example of an actual website, a healthcare website, that we used in our experiment. And this one's written very nicely. It starts off, "Dear friends, first and foremost, our company is deeply committed to preserving your privacy." Then it goes on and discusses some of the things that they do to try to protect your privacy. So this is something that you would commonly see on a website. The second variant, we took that same policy and we turned it into a list of goals and vulnerabilities based on our taxonomy. And this is what that would look like. Just a list of basic goals that start off with some sort of action word. So we took off all the what we call fluff from the privacy policy. Things like, we really care about your privacy. We strive to protect it. And we do all that we can. And once we get rid of that, we can narrow it down to the actual things that they do. They maintain confidentiality. They avoid collecting information unless you provide it. They guard your information. They use it for research, and so forth. The third variant is a categorical list. So what we did was we gave the different categories of the taxonomy, we provided those and gave a link, like up here. This is just 3 of the categories. And we gave a quick definition of each of the category. And if the consumer wants to find out more about what the company does in that particular area, they can simply click on the link. And if they were to click on, say, information collection, this is what would appear. They would see definitions if they were needed. And then there would be the actual policies that apply to that particular category. So in this case, the website used cookies to gather data. And so that would be something that fell under information collection. And the fourth variant was a combination of the natural language policy that we commonly see today, but we highlighted the important text that we converted into the goals and vulnerabilities. And when the user would run their mouse over one of these statements, the goal or vulnerability would pop up, just like it does up here. So in this case, if you ran your mouse over this particular statement, the goal, we avoid disclosing PII without consent, would pop up. So this one is the most detailed out of all of them. It provides the natural language policy and it provides the goals and vulnerabilities. So it's very detailed with lots of information. Okay, another thing that we provided in our experiment is we didn't want it to be content specific. So we provided 3 different websites to our users. And we chose these actual websites. And one was drugstore.com, one was healthcentral.com, and one was novartis.com. And we chose these 3 because they're all in the healthcare arena. And drugstore.com had a huge number of vulnerability statements in it, which means that the majority of the information in drugstore.com's privacy policy was about things that could lead the consumer to be vulnerable to bad things happening to their information. Novartis.com, on the other hand, was more protective. They took a lot more measures and they talked more about protecting the information and didn't have as many vulnerability statements. And then healthcentral.com was right in the middle, so that was more of our control factor. So our experimental design looked like this, and we had these 12 cells. So when you came to the website where we ran our experiment, you would be given a policy that fell into one of these cells. And in the end, after we got rid of all the invalid data, we ended up with 993 usable responses, and they were pretty much equally distributed through each of our cells. So now I'm going to run through some of the results that we got, and I've included both some averages, some percentages, and some p-values because I know some people are very interested in p-values, some people are more interested in percentages, and some people are more interested in averages. So I'll go through these quick, and at the end, if anyone has any questions, I'll be glad to come back to these if necessary. So in terms of our demographics, one thing that we always do with our surveys is we don't just use a student group to run our surveys. We always put these out there for the general population because we don't want to find out just what college students think. We want to find out what the people in their 30s think, the people in their 40s, people in their 50s, people in their 60s. We want to find out what all of these people think because they're all important when it comes to the online business. So what we found is that 41% of our respondents had engaged in online healthcare research at least once a month in the past year, in which that's pretty consistent because we've found in lots of other surveys that consumers in the U.S. are going online more and more for healthcare information and for healthcare products and services and advice. And there's several reasons for that, for the convenience and also for the privacy factor and for the fact that they don't want to be embarrassed by having to go somewhere. We had 31% that had made a healthcare-related purchase online, and that's pretty consistent with other surveys as well. We did have a more highly educated population in our sample in that 53% have beyond a college degree. So what that means is that when we look at our results, we need to think about this in terms of the overall results are coming from people that are a little bit more educated than the general population. So that's something that brings out an interesting point here in a few minutes. We also had a highly skewed male population as well. I'm not sure why that happened, but... Okay, so I'm going to run through some of the questions that we asked. What we did was we gave each person a policy to read. It could have been the natural language policy, it could have been the category policy, it could have been the goals and vulnerabilities policy, or it could have been the goals and vulnerability combined with the natural language policy. Also, it could have come from Novartis, it could have come from Health Central, and it could have come from drugstore.com. Now, when we did this, we got rid of the name, so the user didn't know what the name of the website was. We just used brand X so that they wouldn't be